Good morning and thank you for joining us. Teresa is not here today for the YouTube session. I will now report our case counts. We now have a total of 12,719 cases, an increase of 23 cases from yesterday. 2 cases are related to an outbreak, 2 are community acquired, 8 are close contacts of confirmed case, and 11 cases are still under investigation. At the moment, we have 301 cases that are currently active. Unfortunately, we have lost 368 people to COVID as in our region. This is an increase from four people who lost their lives from yesterday. Of these 4 new deaths, 3 are from long-term care home, 2 women in their 80s and a woman in her 90s. 1 death is from the community, a man in his 80s. My condolences are to the family who have lost their loved ones, and I hope that they find peace and comfort in the coming days. 36 cases are currently hospitalized, 6 are in ICU. There are currently 11 active outbreaks in Windsor and Essex. 5 are in long-term care home and retirement home, 2 are workplaces, 2 outbreaks in hospitals, and 2 community outbreaks. We have in Windsor-Essex area a total of 22,832 doses have been administered. Out of these, 10,614 individuals have already received both their doses of vaccine, and 1,604 individuals have received only their first dose. I'll now continue on with our epidemiological summary for this weekend. So very quickly, starting off from what we are seeing around the globe, and as we continue to see, the cases are declining in almost all the countries, and when we're looking at these comparator countries, what is of significance is that the cases in United States have gone down significantly compared to where it was. And while the rest of the countries still are seeing cases, Canada and others, they're all in the declining trajectory. Similar picture in the number of deaths. As we know, when cases increase, the number of deaths also increase, and we continue to see that they are on the decline, but still cases are happening. And in Canada, we're also starting to see a decline in the number of deaths related to COVID. Focusing now only in Ontario, this is what the picture looks like, and we have seen a huge spike of cases in early January, and now we're continuing to see a decline in the number of cases across the province. Focusing just on Windsor-Essex, and what we can see is the cases are on the decline. We have seen a little increase in the last few days, partly linked to the outbreak that we are seeing in the shelter population. Other than that, the cases are pretty much stabilizing in our region. Looking at our 7-day average and comparing it with the province in 2 different axes at this time, what we can see is our cases in Windsor-Essex, they increase rapidly, and then we are already we have seen that the cases declined rapidly as well. So which is a good sign for our community that we are getting back on track to where we would like to see ourselves as the region. Looking at our overall cumulative case counts, we have seen a very steep curve, almost looking like a wall in December and in early January. Now we are starting to see some flattening of that curve as well, but we are still in the very early stages of that, and we like to see that sustained and ongoing by having and following all these public health measures in the region. Similar picture in the cumulative deaths in Windsor-Essex. We have seen a sharp increase in the number of deaths starting in December, continuing all the way in January, and still seeing some effects of it. And we're starting to see some early signs of stabilizing again in the number of deaths in the region. This slide captures the week-over-week incidence rate per 100,000 population, and it goes by week to week, and the week ends on Sunday. Looking at the past 7 days, our case rate is 58.1 cases per 100,000 population. This is a slight increase from last week when we had an overall case of 46 cases per 100,000 population. And again, partly some of these numbers that we are seeing as a result of the outbreak and not necessarily a reflection in what's happening in the community. Comparing ourselves with our weekly case rates with the province and with the rest of the southwestern Ontario, what we can see is something similar. Our rates are pretty much coming closer to the rate where the provincial rates are, and we're basically at the same level at this time. So as we talk about that, this is the wastewater surveillance data in the red line, and we continue to see a downward trend, which for the most part correlates with our case counts as well. We have seen some fluctuation in the past week, but it may be just something that we can anticipate looking at number of factors. And also just a disclaimer that this particular methodology of analysis for wastewater sample is still under developmental in a research phase. It's currently being validated through a number of pilot studies conducted in collaboration with university laboratories, municipalities, and the ministry. So as such, these results are still preliminary and are subject to change. It just helps us to guide and understand some of the data that we are seeing in our region. When it comes to the person positivity and the number of tests in our region, these figures look at all the tests that are conducted in unique individuals in Windsor-Essex. In total, 265,573 tests were completed as of February 13th. This is a complete week ending on a Saturday. For the week ending on February 13th, our person positivity was 2.9%. Last week, approximately 8,283 tests were completed last week. This slide looks at the most recent 7 days worth of data results, looking at the person positivity in the province of Ontario. And again, the most 7 days are preliminary, and as we continue to add more data, it may change. However, in the past 7 days, Windsor-Essex has the 8th highest person positivity in Ontario. If you recall, there were in December, late December, early January, our person positivity was the highest in the province. So right now we are at 2.3%, which has slightly decreased from last week as well, when we were at 3.1%. Looking at person positivity by age group, the 0 to 17 age group remains the highest and is starting to increase once again. In comparison, the other age group are generally low, but we may be seeing a slight turn upwards. But overall, I think it's too early to say where this picture and trajectory is going. And please note that when we are talking about person positivity by age, you also have to understand how many people in that particular age bracket were tested too. So if there are less people who are tested and based on their symptoms and their likelihood of being positive, we may expect to see a high person positivity in that particular age group. Looking at the most 7 days and putting the person positivity in with respect to the map in Windsor-Essex by forward sortation area. Using the first 3 digits postal code, we see that there are some pockets which has a higher person positivity compared to the rest of the region, but overall we can see that the general trend of person positivity is declining across the region, with some areas that are still having a high person positivity. The majority continues to be between 2 and 5%. This graph looks at the percentage of test results that are available within 1 and 2 days of someone getting tested using a 7-day average, and approximately 48% of tests are being processed with results available within 1 day of being tested. Within 2 days of testing, 91% of tests are being processed with results available, so which is a pretty good turnaround time from the lab perspective. When comparing ourselves to other health units using the 7-day average, we are once again in the bottom third of the province with how these test results are available for us by the time the test is conducted, and then by the time it goes to the lab and an analysis is done. Overall, on an average, we are sitting at 1.7 days. So when someone is getting tested, it's taking overall 1.7 days to get their results back. And this is a slight increase compared from last week when we were at 1.5 days. When it comes to overall rates of COVID in Windsor, in Ontario, Windsor-Essex has the second highest rates of COVID-19 in the province. Breaking that data down by municipalities, Leamington and Kingsville, given their low population size and the high number of temporary foreign workers, and with the number of outbreaks in that region, they continues to have the highest case rates in the region. The rest of the municipalities are somewhat similar, and outside of these, Leamington and Kingsville, Windsor continue to have the highest case rates. More recent picture, Leamington continues to be the highest, followed by the city of Windsor. There are more cases that we have seen in the last 2 to 3 weeks in Windsor, and then the rest of the municipalities are also are somewhat similar with respect to the case rates. Overall distribution of COVID-19 cases by municipality, Windsor continues to be having the highest burden of COVID-19, given that most of the cases, most of the people live in Windsor. That's up to 54%, followed by Leamington and Kingsville, while the rest of the municipalities have pretty much the same number of cases. In the last 30 days, no change in terms of overall pattern. The pattern continues to remain the same. In the last 7 days, similar picture with some changes and with some cases that we are seeing in Tecumseh and Lakeshore. Otherwise, the overall trend continues to be the same. Sorry, I forgot to mention LaSalle as well. So LaSalle, Tecumseh are seeing a slight increase from where they were based on the 30 days average and in the last 7 days. Looking at age and sex distribution, we're starting to see similar picture, not much different. What is notable, at least in this slide, is the age bracket between 20 to 40 years. In the last 2 weeks, the overall cases are declining in that group, and but the rest of the cases are pretty much similar of what we are seeing in the data. When it comes to non-epi-linked cases, and based on the 7-day average, we are seeing that on an average, 23% of our cases do not have an acquisition source, or they are considered as non-epidemiologically linked cases, and that is pretty much stable, where we have seen between 20 to 25% of the cases in the region that are generally non-epi-linked. This graph looks at the exposure history by the from October to present, and we can see that we continue to see a mix of community spread versus household contacts and close contacts. We have seen a spike in the community spread in one particular day in the graph, but overall it's pretty evenly distributed. This is just a focus more on since February to present. When we're looking at acquisition sources by municipality, this is what the overall trends look like. And as you can see here, in some municipalities, the cases are linked mainly with the outbreak, and while the rest of the municipalities, it is a combination of household contacts and close contacts. With respect to the number of active outbreaks, as of February 18th, we have 11 outbreaks that are currently being followed by the health unit, and we are also starting to see that most of these outbreaks are resolving, and we are moving into a better position. Hospitalization and ICU data also have seen a huge surge, but then are still at a high level and maybe stabilizing at around 35-36 cases at this time, which is still high compared to where we would like to see with respect to our hospital capacity. The overall COVID-19 admission by day, it is also seeing a declining trend, which is a good sign. So we're hoping that the trend will continue, and then the ones that are currently hospitalized, they will start to get discharged, and the number of people in the hospital will decrease. This is in total, not only just the COVID patients, but also people who are in the hospital for various medical concerns. And we can see that the hospitals are working at a very higher capacity at this time, and which is signaling that additional cases or additional health issues in the region can put a stress in the system. When it comes to ICU occupancy, we had some time in early January when the ICU beds were really full. We are starting to see an improvement in that, and with ICU capacity running roughly around 50%, and the vented adult ICU bed occupancy at 25%. So overall, 94% of or 95% of our cases in the region have resolved. There are 1.4% of people who are currently self-isolating, and unfortunately we lost 2.9% of our population to COVID. We report day-over-day deaths, and as we reported earlier, that sometimes these deaths are the number of deaths that we reported every day didn't necessarily happen yesterday, and they may be reported late to us. And so this particular graph gives you a breakdown of each of these deaths that are reported to us on any given day. The age and sex breakdown of COVID-19 deaths, we can see that 96% of our deaths happen in individuals 60 plus and older. And out of these deaths, what we know that roughly 2/3 of these deaths happen in the long-term care home and retirement home. But of note, 1/3 of these deaths happen in the community. And the majority of these deaths continue to be in the elderly population. Overall, our case fatality rate, when we are comparing ourselves with the Ontario long-term care home fatality rate, we are slightly better, but when we are looking at our overall case fatality rate, we are slightly higher than the provincial rate of 2.3%. We are at 2.9%. Our day-over-day doubling time continues to improve, and as we discussed earlier, if the number is high, that means we are doing well. If the number is low, that means we are doing poorly. So on the blue line, which is Windsor-Essex, we can see that we are doing much better than the provincial and the Canadian doubling time. Looking at our R0, the most recent estimated median R0 is 1.14. This is a big jump from last week, where we were at 0.76. And as we have talked about, when the R0 is greater than 1, each existing infection causes more than one new infection. If it's lower, that means that our case counts are increasing. So as we've reported in our data, some of these recent increase is attributed to the outbreak that we are seeing in the shelter population, and it could be a reflection of that, or it could be a reflection also to show that maybe the cases are continuing to spread in the region. So we'll have to keep a close eye on that number at this time. So in summary, the cases rate increased slightly in Windsor-Essex. Our acquisition source is distributed everywhere, as we talked about, mainly in the household contact, close contact, but also we are seeing 25% of cases in the community transmission. COVID-related hospitalization continue to decrease, and the number of outbreaks in the region is also declining. So this is the summary slide. Our most recent 7-day case rate is 58.1 cases per 100,000 population, percent positivity 2.9%, and our R effective is 1.14. And just to put things into perspective, when for the criteria for staying in the red control zone, when we have a weekly case rate of 40 or more, which we have right now with the percent positivity of 2.5 or more, which we are at a higher percent positivity, and the R effective of 1.2 or more, we are slightly better, but still coming very close to 1.2 R effective mark in the region. Thank you.
We'll now take questions from the media. We'll start with CTV.
Yes, good morning. I know it's still pretty early to reflect some of the indicators, but how do you feel that the region is doing in the red zone so far?
So I think when I'm looking at the cases that are coming to us, I think we're not doing worse that I can say, but we're still seeing some transmission. So I think the key part is we have to remember that we still have a large number of positive cases in the community, and there is still 25% of community transmission related cases that we are seeing in the community. So when we are out, we have to remember that. When we plan to do something, we have to remember that. This is a very difficult time for everyone to continue to follow these public health measures that most of us are following for almost a year now. But we have to do it. There is no other way. Otherwise, we will continue to see another surge. We'll start to see more hospitalization. We'll start to see more people dying. The only way to keep it contained is continuing to focus on the public health measures and continue to follow those measures.
When would you expect to see some of the restrictions eased? Next week or even after that?
I don't anticipate that we will see any restrictions easing off next week because, as we have noted, our numbers slightly worsened this week. It's not a huge jump, but it's a jump. We do have an explanation that why it happened, but still, I think we have to be really cautious with what we are dealing with. And also on top of that, we are also aware that we have already seen 2 confirmed cases of COVID variant in our region. And if COVID variants start to transmit in our community, the case counts can increase significantly. So I think we just have to take a very cautious approach, and we want everyone to continue to follow the public health measures to keep everyone safe.
Okay, thank you. And I just have a couple quick questions about the volunteers for the vaccination rollout based on the news released yesterday. When are you hoping to have those volunteers in place, and how many are you looking for?
So I think right now we're collecting that information. We are everything is highly dependent on the vaccine supply, and once we have a better handle on confirmation on how much of vaccine we will continue to see every week on a consistent basis, we will be in a much better position to say that we need this many vaccination sites, and we need this many volunteers after going through the our staffing and some of our partners' healthcare staffing to provide that resource to each of these mass vaccinations. So I don't have a number at this time. It would be more of getting into a registry, because many people have approached us and expressed their interest in volunteering. So that will be one way to keep track on who we can count on when we need to pull that trigger and on the mass vaccination clinics.
And can residents without a healthcare background also volunteer?
That will be through the municipalities. We are focused on the healthcare worker piece. There may be other opportunities for the community to volunteer, but this specific request is for people who can actually vaccinate.
Okay, thank you.
Any questions from CBC?
Hi, good morning. Dr. Ahmed, I'm wondering if you have any information to share about vaccinations within Indigenous communities and vaccinations of Indigenous people. I'm wondering if the health unit has completed vaccinations for elders in congregate settings and Indigenous seniors with health conditions.
So I think your question is about the Indigenous seniors and Indigenous elder care home. I'm not aware of any. Can you hear us?
Yep.
Okay, yeah, so I'm not aware of any elder care home in our region, and we are working closely with the Southern Ontario Aboriginal Access Health Center to work through, more details with the seniors in the Aboriginal or the Indigenous population. The most of these priorities, as we are seeing, is linked with the northern and the remote communities in the Indigenous population. Our Indigenous community is pretty much integrated within Windsor-Essex, and that's why we are working closely with SOHAC to help us, identify the plan and to make a plan that works well for the Indigenous community and to help them vaccinate.
Thank you. I also wanted to ask about asymptomatic testing within schools. Are you able to explain how that will work and whether there's any update there?
So the update is we are working with the school board. In terms of planning that how it will be rolled out. We have some information from the ministry, but I think some of that does require collaboration between the school boards and the health unit, and also potentially health system partners or third-party agencies who can do that testing. So there are a number of moving pieces at this time. We're hoping to have all of those details sorted out, and then appropriate lead can be taken by the school board. So it's a direction from the Ministry of Education to the school board, and then the school boards are working with the health unit to make sure that they have all the right pieces in place to meet that target.
Thank you.
Any questions from Blackburn?
Just to follow up on the last point, when do you hope to have that in place, or is there a deadline for when the schools need to have that in place?
I am not aware of any deadline. I think the direction is provided to the school boards and not necessarily to the health unit, and we are supporting them. We may provide them with some high data on the highest school that they can start targeting, and then they have to look at the resources that how these tests will be conducted and who will be doing that test, and working in consultation with the health unit.
Okay, and just to follow up on some of Melanie's questions, when you're talking about moving through the stages, I know they like to have at least 2 weeks of data, and so to go to orange, we need to be below 40 per 100,000. Would that need to be like sustained over a period of time, or would it be kind of like once we hit that mark, they could change us in the next round of changes?
So I think until we get a better handle on what's happening with the VOCs in the province, and how confident are we on the data that if we hit below the 40 mark, that it would stay that way, or it will continue to improve, then I think it would be an easier decision to say that, once you hit the mark, move on to the next or lower tier of restriction. But at this time, I think even with the fluctuation that we are seeing, I'm not sure that if we feel that confident at this time that we are ready to go to any level below red.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. How likely is it that this upward trend will continue, considering much of the recent rise is attributed to the outbreak among the homeless population?
Well, I think even if we remove that number from our cases, we are still seeing daily cases between 20 and 30. And if we do the maths, let's just take a midpoint 25 times 7 is equal. We're talking about almost 175 cases, and then we do the maths by dividing it by 4. So we're still looking at close to like between 40 and 45 cases per week, which is still will put us in the red category. So I think unless we start to see cases between 10 and 20 on a consistent basis, only then we will go below the red zone. And the rest of the indicators, as I mentioned, person positivity are effective, and then the hospital system capacity, and any concerns with the ongoing outbreak will be another qualitative data that we need to look at.
You mentioned some pockets across Windsor-Essex have higher rates than others, and you showed us that map. Do you have any reasoning for that? Is there an explanation for those pockets?
Not really. Sometimes we just see more activity in one region than the other, and sometimes it is linked with an outbreak as well. So the map that I showed, it shows you the person positivity, and then when we're showing the person positivity, it just focus on the overall cases. It doesn't differentiate whether these are the household cases or whether it's a link with the outbreak, but that's a very crude way of looking where the transmissions are happening, or where sorry, shouldn't say where the transmissions are happening. It's a crude way to look at where these individuals live that are showing up, and when they're going for the testing, most of these people are coming back as positive. So I think it does raise the question that if there is anything in particular happening in that region. But with the case counts so low, sometimes it's not easy to explain that data. If the case counts are really high, then we can. But with the low case counts, it may not be as simple explanation as anything in particular that's happening in that region.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, just following up on Maureen and Melanie's questions about the red zone. Is it fair to say that since we've only been in a red zone for a couple of days now, if our numbers increase more next week, like, is it still too early to say this week's numbers are because we're in red zone?
Yes, we are. I think we haven't even seen any changes because the red zone technically started on Tuesday. So it's just 4 days of data that we have seen, and we know that it takes at least 14 days before we can see any significant changes with easing some of these restrictions. So I think it's too early. What we're seeing right now is still maybe the result of where the restrictions were, rather than what happened since Tuesday when everything started to open up.
And then this past week, there's been a number of possible exposure point releases that have been sent out. We haven't seen those in quite some time. So with those exposure points, are those, I know one was because of the variant, but the other ones, could those be because of the red zone? Is it employees? Any comments on those releases that were sent out?
Well, most of these time, because there are there are some places, whether we're in gray zone or whether we're in red zone, they stay open. And when a sick individual, either even during their incubation period while they're infectious, so someone can be infectious before 48 hours of exhibiting their symptoms, if they visited any of these facilities, so they may have put other people at risk. So that's when the notification comes out. So the only thing that I can say is with the exposures notification that you have seen is based on those individuals and when they acquired the disease, or how likely they are to put other people at risk. That's when these notifications are triggered. I can't say anything in particular that it's because of the red zone or the gray zone.
And then one final question, switching gears a bit here, just going to long-term care homes. Any updates in regards to the village at St. Clair? I noticed on the website still listed as outbreak. It goes back to early December. How is that facility doing?
Well, this facility has come a long way, and we're seeing a lot of staff turnover and a lot of resources that went into to support that facility. Unfortunately, we're still seeing an occasional case or two after a certain number of days, and this could be a result of someone acquiring outside what happens to work at the facility and putting prolonging the outbreak in that facility. don't recall that I have seen a recent case in the resident, but I'll have to double check on that. But my understanding is most of the recent cases that we have seen at Village at St. Clair are in the staff.
Thank you.
Any additional questions from CTV?
Yeah, just one more. I understand you're part of a virtual panel discussion today on vaccine hesitancy. What's your message to people with concerns over and hesitancies over the vaccine?
Well, I think what we are trying to do is to provide the information, address the questions that people have in their mind, and provide them to make that connection directly to hear from the experts, and demystify some of these questions that often circulates and comes in everyone's mind. So we're trying to make that connection to ease some of these concerns, and hoping that people who have any concerns about the safety and effectiveness of these vaccines, they should hear it, and they should listen from the experts and get their questions answered.
Okay, great. Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you. Have a great weekend.
Great. Thanks, everyone. Have a great
Thank
weekend.
you.